We know that the current crop of vaccines prevent individuals from getting seriously ill with COVID-19. But will they also protect us from getting infected in the first place, and by extension, from infecting other people? We'll explore the science around that on this episode of Shareable Science Beyond the Blog. Welcome to Shareable Science. Science you can share. The clinical trial data showed us that the current crop of vaccines is very effective at reducing the severity of a COVID-19 illness. That's what those vaccines were intentionally designed to do. So, green check mark there. What we don't know is if those same vaccines actually prevent us from becoming infected with the SARS-CoV-2 virus. That's a really important piece of information that we'd like to know. Let's delve a little bit into the science behind why we do and don't know that. So, our current vaccines actually inject the vaccine into the muscle cells of our arm and then trigger a systemic immune response. So that set of antibodies and T cells and that entire process. And we know that that immune response is very effective at preventing a SARS-CoV-2 infection from becoming serious COVID-19. But if we were looking for a way to prevent infection from taking root in the first place, we would be paying attention to our nasal and upper respiratory cavity. Now, I know you've missed my drawings, and this drawing looks either like a combination of Herman Monster or potentially a supermodel from the 1980s with the giant shoulder pads. But hang with me. If you squint, it really could look like a person. But the immune response in your upper airway is a different type of immune response. It's a mucosal. It's based on immune responses in the mucous linings of your respiratory system. And without getting too detailed, it's primarily driven by a type of immunoglobulin called immunoglobulin A instead of the immunoglobulin G that we find in the systemic immune response. That doesn't mean that our current vaccines aren't effective and don't make their way into the upper respiratory system. But if you were looking to develop a vaccine that primarily reduced infection, you would be thinking about making sure that you could target that mucosal immunity. So the question before us is, do the current vaccines, which again are designed to keep us from getting sick and getting hospitalized, do they also provide that level of immunity in our respiratory system? Side note, there's a whole set of vaccine candidates in early stage clinical trials, phase 1 clinical trials, that actually are injected as nasal sprays. So they actually build an immune response starting with your upper respiratory system. We'll see if those are effective or not, but that could be a way to actually solve both of these problems a little further down the road. All right, the current crop of vaccines gave us some initial hints that not only would they reduce serious illness, but they might also be effective at reducing infection. So we saw some initial data from Moderna and from Oxford AstraZeneca, and actually from the Johnson & Johnson details that the FDA released just this morning that hint that these vaccines may be effective at reducing infectiousness as well. But those are early hints. We actually need real-world data of how the vaccines are performing, not in a clinical trial setting, but when they're administered around the world. And we've begun to get a glance at that first set of data. I'm going to tell you about 3 studies, and I'm going to caution you, these are all early data, so they're encouraging, but I want to be careful that we don't take the numbers here and take them to heart and say, whoop, there we go, that's the information that we need. So the first is a study out of Israel. And you're going to see lots of data coming out of Israel in the next several weeks. They really are leading the way in the way that they have vaccinated their country, the population, and the way that they've connected that information to their digital health record. So you're going to see a lot more of these studies coming out of Israel. This one specifically looks at something called viral load. And that's looking at a swab from inside your nose and measuring the amount of virus that is present in that swab. It's a rough proxy for how infectious an individual might be. A higher viral load indicates there's more virus in your nose, which again would indicate potentially that you are more infectious. So this study in Israel looked at individuals that had gotten the Pfizer vaccine, specifically after their first dose. And they looked at individuals that had had the first dose but still developed COVID-19, that still got infected with the SARS-CoV-2 virus. Remember, none of these vaccines are 100% effective, and in these two-dose vaccines, there's still a window early on after that first dose where you don't have a very high level of efficacy. So they looked at individuals between their first and second dose, and I've just shown you, I've just made up some red X's. That indicates people who were vaccinated but then developed a SARS-CoV-2 infection, and they compared the viral load in the nostril of individuals that developed an infection within the first 11 days after dose 1, and then from 11 to 28 days before they got dose 2. And they actually found that the viral load of the individuals from day 11 on was 4-fold lower than the viral load earlier. And we know that it takes a while for an immune response to actually even develop after that first dose. So again, this is not definitive answers, but it hints that there is an immune response building that is reducing the amount of virus that is allowed to replicate in the upper respiratory system of individuals that do get infected. Here's the reference for that. It's a preprint. So remember, preprints mean that it hasn't gone through peer review. Another preprint actually looked in the United Kingdom, this time at over 20,000 hospital workers who were vaccinated. And these hospital workers, before and after vaccination, this was primarily with the Pfizer vaccine, a little bit with the Oxford AstraZeneca vaccine, they were then analyzed, in some cases, multiple times a week. They had a nose swab, and they were tested to see if they were infectious. So again, they're looking not only at symptomatic COVID, I've lost my sense of taste and smell, I've got a fever, but asymptomatic, the virus is in my upper respiratory system, but I have no symptoms. And they actually estimated, based on the data, that there's a 70% efficacy 3 weeks after you've gotten your first dose. That 70% efficacy is lower than the 94 and 95% numbers that you're used to seeing, but remember, those numbers are estimating the efficacy of symptomatic COVID. This number is actually estimating the efficacy of symptomatic and asymptomatic. So it's taking into account, are you actually infectious as well, not just are you showing symptoms and getting ill. And then they bumped that percentage up to 85% after the second dose, although that's a really small number of individuals in their study. And here's the preprint reference for that as well. You may also have heard a lot of news earlier this week about a study coming out of Israel, also with Pfizer, that suggests that you might be dealing with 90% efficacy against symptomatic and asymptomatic. I want you not to pay too much attention to that 90% number. I can't even tell you that there's a preprint for that. That was based on some pictures of pages of a manuscript in progress that were leaked on Twitter. So we don't even have a paper. We don't even have all the data. But it shows you the challenge of keeping up with science in a world where it's not just did you publish the paper and it's been peer reviewed, and not only did I put out a press release, but did somebody leak the data and now it's become international news. I would hold on that. I would take a really big shaker of salt before I paid a whole lot of attention to that 90% efficacy number and that it significantly reduces the risk of transmission. Still, it will be really interesting to see what that paper ultimately looks like and what those numbers tell us. So in general, we've got some pretty good hints that there seems to be a fair amount of protection, not only from getting seriously ill, but potentially also from developing an infection or passing that on to other people. But as always on Shareable Science Beyond the blog, I'm going to give you some cautionary tales, some caveats, and there are two pretty big ones that we want to pay attention to. The first is that all three of these studies are observational studies. It's based on the population that participated. So these are not clearly split case control where you can definitely say that the people who got the vaccine are matched in every way against the people that didn't get the vaccine. It's always possible that the people that got vaccinated, just by their own behavior, are less likely to engage in risks that bring them into contact with the virus. That has nothing to do with whether they got vaccinated or not. That's their own behavior. Or the people that didn't get vaccinated or got vaccinated later in this study might be part of a population that is in a job where they are more likely to come in contact with the virus, and so there are more chances for them to get infected. Again, doesn't have anything to do with this particular study on the vaccine, but it's a pretty significant demographic difference. So we want to be careful that we don't read too much into this. The second piece is this is giving you information about your immune response right after you've been vaccinated, when it's at its strongest point, when there are the highest amount of antibodies flowing through your system. We really want to know what level of protection you have at 4 months, 8 months, 12 months out. So we've got to wait for that. And that brings me to my last point, which is about messaging. Public health officials and researchers, when they talk about what the vaccine can do, they are very careful to only talk about things where they know they have the data to back that up. It's why I'm careful to tell you about the caveats and about the concerns and when it's a preprint or not. Because I want to make sure that I don't unintentionally have you finish this video thinking that if you've been vaccinated, you now are free to take off your mask and hang out with anybody you want without any mask and without social distancing. We don't have that data. But on the flip side, what sometimes gets heard isn't we don't yet have the data, but people hear we don't know the data, so that must tell us that there's evidence that actually the opposite thing is true, that vaccines don't provide you any protection against infectiousness. We have no reason to believe that. Many different kinds of vaccines not only prevent you from getting ill, but also provide you with protection from infection. There's no reason to think that these vaccines won't either, but we just have to wait for the data. And you and I have been waiting for 11 months, and it is hard to continue waiting, but that's what we've got to do. Okay, we covered a lot of detail and we dove deep into lots of different parts about your immune system and about biases in studies. Thank you for hanging with me for this. Please share this with people that you think might also find this information useful. Thank you for watching, and I look forward to seeing you on our next episode of Shareable Science Beyond the Blog. Take care.